I am thrilled to represent the Department of Health and Human Services and the Office of Substance Use and Mental Health, and welcome everyone to today's summit. The summit is focused on improving systems associated with transition-aged youth.
And hello everyone, my name is Brandon Bond. I use the pronouns he and his. For my career, I am a mental health and well-being student advocate at the University of Michigan.
Hello everyone, my name is Mohammed Shahid. I just finished my freshman year at the University of Pittsburgh studying neuroscience. And the reason I'm here is I'm Egyptian, my family's from Egypt, and that is an area in the Middle East where mental health, youth policy, things like that are very stigmatized.
Hi everyone, my name is Kira Boxall and I'm a senior at Portsmouth High School in Portsmouth, Rhode Island, and an incoming freshman at Boston College studying biology and economics.
Hello everyone, my name is Ray Scott. I use he, him, and she, them pronouns. I am the executive board president of global nonprofit Students with Psychosis. I am a current student at Ohio State University working on my bachelor's in social work. I have an associate of applied science from Columbus State.
Hello everybody, my name is Kaden Riley. I am a lived experience foster care and child welfare advocate.
The question is how do I stay motivated within the process? I would say it's a praying game, and it's a game of consistency and again knowing what my end goal is, which is to improve outcomes. And though I may receive so many no's and one yes, that one yes will change lives. So I was just saying, staying consistent, knowing what your end goal is, and knowing that the work is meaningful that you are doing.
I think a lot of things that I've been fortunate to be a part of have really mobilized our youth to create the change that they want to see. And with my organization, I want to really mobilize other youth to be change makers in their own communities.
This research, the purpose was to understand the recent international movement for 3-digit national suicide prevention and mental health crisis hotlines. In particular, the use of the 988 dialing code in both the United States and Canada. And I don't know if a lot of people know, but the United States launched 988 in 2022, and Canada followed suit in 2023. And then to hear that Canada had did so, but that the conversation was not in the United States, was really interesting to me. And I think it kind of suggested a sort of unidirectionalism in that Canada was probably talking about the United States a lot more than the United States was talking about Canada, right? So that's what kind of established the preliminary view.
So something's happening. Like, I don't know if you all are noticing it, but like everybody's talking about youth mental health in a way that we weren't just four or 5 years ago. Peer-to-peer programs are actually an evidence-based practice from the Substance Use and Mental Health Services Agency of America, and they have named them for more than 20 years as essential to reforming our troubled mental health system. And we assembled the resources with the support of philanthropy and the city of Los Angeles to develop a concept that would provide hundreds of youth with the opportunity to become certified peer counselors and support their friends and other young people in the youth source centers.
Maryland has a statute that gives minors who are not in the physical custody of a parent or guardian and experiencing homelessness legal capacity or the right to consent on their own to admission to an emergency shelter and to receive supportive services from that shelter provider.
Really, youth engagement, I think, is where a lot of communities are, bringing youth to the table around a specific issue, but to truly share power, to truly give space and step out of the space and allow for youth leadership, while difficult, is really where we are working to be as a community. And that's where you see real change happen, is when you stand shoulder to shoulder with a young person and you share that power opportunity to create change. I can tell you, after a decade of working with young people, particularly in this space, that we're always better off.
We wanted to ensure that this project was being led by youth voice and youth experiences, and that's what was going to our government, and hearing what the reality is that we face and what we hope to accomplish with this money.
throw in there that youth are just like kind of cooler than anybody else. And so the first year that it was applied, young people were not involved in that at all. And as soon as young people were, they really saw what we were working with and what we're made of. And I think that's something that you cannot deny is the transformative power that comes with bringing young people with our creativity and our style. I think we bring something special to the mix.
I just want to say, we're coming from different backgrounds, but we all come together and share our stories and making a change in the community. I think that's what's really important on the Youth Action Board.
We call the process Reframe the Age. So the service authorization, which is who gets authorized to participate in Department of Mental Health Services, that process left a lot of older adolescents falling between the cracks. And so our Child, Youth, and Family Services ended at the age of 19. So at that point, either they had to go into our adult service system or in many cases didn't qualify based on their diagnosis. The regulation change allowed them to remain in our service system until their 22nd birthday. One of the other goals was that perhaps they need, because we don't have a specific young adult service system, some services within Child, Youth, and Family, some services within our adult system. And so that's where you see the little Venn diagram there, where they're really able to have a more permeable participation within a wider variety of services.
So a guaranteed income is a recurring cash payment. In most cases, it is a monthly cash payment given directly to individuals. It is unconditional with no strings attached and has no work requirements. A guaranteed income is also meant to supplement rather than replace the existing social safety net, and it can be one of many approaches that contribute to advancing racial and gender equity.
In terms of positive outcomes, just a couple of things that we have gleaned from our current data report is students are able to handle a $400 financial emergency, and they're also able to afford expenses that they weren't able to afford. One of the really interesting things about our cohort is a lot of our participants were able to kind of pay it forward. Like they had additional cash and they were able to help support their community in helping their family or friends or neighbors effectively cover their emergent needs.
I believe with that will conclude this year's second annual Transition Age Youth Summit. And thank you so much for your attendance, your engagement, and we are really looking forward to staying connected and looking into year 3 and what comes from the advocacy work that we are both doing as youth and community members. So thank you so much.